5G Unveiled, the hidden truths and the health risks behind the hype. The advent of 5G technology, the fifth generation of wireless communication, marks a significant leap in connectivity, promising faster speeds, lower latency, and the ability to connect a multitude of devices. Operating primarily in the millimeter wave spectrum, 5G can achieve data transmission rates of up to 20 gigabits per second, which is up to 100 times faster than its predecessor 4G. This enhanced capability enables innovations across various sectors, particularly in healthcare, where it facilitates telemedicine, remote monitoring, and even robotic surgeries, thereby addressing some of the current challenges in healthcare delivery. Yet beneath the allure of seamless connectivity and futuristic applications lies a growing concern, a concern that whispers of potential health risks, of unseen forces that might be shaping our well-being in ways that we're only beginning to understand. As 5G towers quietly rise across cities and towns, so too does the anxiety over what this invisible web of electromagnetic waves could be doing to our bodies. Is this technological marvel a harbinger of progress, or does it carry hidden dangers that might only surface in time? As we delve deeper into the world of 5G, it's crucial to explore not just its promise, but also the hidden truths that could impact the very fabric of public health. Welcome to the Global Insight. 5G technology represents the latest evolution in mobile networks, offering unprecedented speed and connectivity. Operating primarily in the millimeter wave spectrum, it supports faster data transmission and greater bandwidth, which enables a vast array of new applications from smart cities to autonomous vehicles. However, the transition to 5G has not been without controversy. The use of higher frequency bands, which are more effective for transmitting large amounts of data quickly, has led to increased concerns about the potential health impacts associated with prolonged exposure to radiofrequency radiation, also known as RFR. Unlike ionizing radiation, which is known to cause direct DNA damage and is associated with high cancer risks, 5G operates on non-ionizing radiation, generally considered less harmful. However, some studies have suggested that long-term exposure to RFR, even at non-ionizing levels, may still pose health risks such as cancer and neurological disorders. These studies often involve exposure levels much higher than what the public typically encounters with 5G, but they have nonetheless fueled a debate over the safety of this new technology. As 5G continues to be rolled out globally, understanding the full scope of its impact on public health remains an area of active research and concern. "5G technology utilizes non-ionizing radiation, a type of energy that lacks the power to dislodge tightly bound electrons or directly damage DNA, unlike the more dangerous ionizing radiation, such as X-rays. This difference is significant, as it implies that 5G may not carry the same level of risk as higher energy forms of radiation. However, lingering concerns persist about the potential health impacts of prolonged exposure to RFR. Some studies have associated RFR exposure with various health issues, including cancer, neurological disorders, and reproductive problems. It's important to note that many of these studies involve exposure levels that far exceed what is typically emitted by 5G networks, leading to questions about their relevance to everyday exposure. Despite this, the fear of unknown long-term effects continues to fuel the debate, especially as 5G technology becomes more pervasive in our daily lives. Understanding RFR and its potential risks remains a crucial area of ongoing research as scientists and health professionals strive to determine the real-world implications of living in an increasingly connected, high-frequency world. The scientific community remains divided over the health implications of radiofrequency radiation from 5G technology. Some researchers contend that current literature does not conclusively demonstrate harm at the typical exposure levels experienced by the public. For example, a State of the Science review found that RFR exposure from 5G generally falls below the safety limits established by the International Commission for Non-Ionizing Radiation Protection, or ICNIRP. However, concerns linger about the long-term effects of millimeter waves, a relatively new type of radiation that has not been extensively studied in terms of its impact on human health. As 5G becomes more ubiquitous, these unresolved questions continue to fuel the debate and highlight the need for further research. Human skin serves as a primary barrier, absorbing and reflecting the majority of millimeter waves used in 5G technology. Research shows that at a frequency of 26 GHz, over 86% of the incident power is absorbed within the first millimeter of skin. While this limited penetration suggests a low risk for deeper tissue damage, concerns remain about the potential long-term effects on skin health. Questions have been raised regarding whether this exposure could impair the skin's protective functions or exacerbate existing skin conditions. Although current studies indicate that the skin efficiently disperses the energy from 5G waves, reducing the likelihood of harm, further research is necessary to fully understand the implications of prolonged exposure. Concerns have also been raised about the potential impact of 5G on eye health. A study from 1997 indicated that prolonged exposure to 60 GHz waves could cause thermal effects on the eyes of rats. However, this research did not involve human subjects or reflect the real-world exposure levels associated with 5G. The implications for human eye health remain uncertain, and further investigation is needed to determine if similar effects could occur in humans, especially as the use of devices emitting 5G frequencies becomes more widespread. Some researchers express concerns that exposure to 5G could weaken the immune system, potentially making individuals more vulnerable to illnesses. However, studies conducted by the World Health Organization, or WHO, and the International Commission for Non-Ionizing Radiation Protection, ICNIRP, have not found conclusive evidence supporting these claims. The WHO maintains that current evidence does not substantiate fears of immune system impacts from RFR exposure at levels typical of 5G technology. Nonetheless, the possibility that future research may uncover new insights emphasizes the importance of ongoing monitoring as 5G continues to develop. Examining the global response to 5G technology reveals a spectrum of approaches ranging from precautionary measures to legal rulings that highlight public concern. These case studies provide insight into how different countries and institutions are navigating the complex terrain of potential health risks associated with 5G, illustrating the tension between technological advancement and public health safeguards. Switzerland has taken a notably cautious stance on 5G technology, setting some of the strictest exposure limits globally and continuously monitoring its health impacts. In 2019, the Swiss government paused the expansion of 5G networks, responding to public concerns over potential health risks linked to increased radiation from 5G antennas. This decision wasn't made lightly. It followed the Swiss Medical Association's call to adhere to the precautionary principle, emphasizing the need for stringent regulations to protect against possible neurological and cancer-related issues tied to electromagnetic radiation. A pivotal study by the US National Toxicology Program, or NTP, explored the effects of radiofrequency radiation on lab rats, revealing an increased risk of certain cancers, particularly in males, after lifelong exposure to high RFR levels. While alarming, the exposure levels used in this study far exceed what humans typically encounter with 5G, raising questions about its direct applicability to human health. This disparity underscores the complexity of assessing 5G safety, as the study's findings may not accurately reflect real-world conditions. In a groundbreaking 2020 ruling, an Italian court attributed a plaintiff's brain tumour to prolonged cell phone use, intensifying public anxiety around 5G technology. Despite the ruling being based on expert testimony, the scientific community remains divided on the matter. Some view the decision as a warning sign of the potential risks linked to electromagnetic radiation, while others caution against drawing definitive conclusions from isolated legal cases. This ruling has fueled ongoing debates and highlights the pressing need for further research to clarify the health implications of 5G and related technologies. Regulatory bodies and experts largely agree that 5G technology, when used within established safety guidelines, does not pose significant health risks. The World Health Organization continues to monitor ongoing research and recommends precautionary measures when necessary. Similarly, the International Commission for Non-Ionizing Radiation Protection has set guidelines for radiofrequency radiation exposure, which are based on decades of research and are regularly updated to incorporate new findings. The WHO asserts that there is no conclusive evidence linking 5G to adverse health effects, although it continues to monitor research closely and advocates for precautionary measures in uncertain areas. The ICN-IRP has developed comprehensive guidelines to limit RFR exposure, ensuring that 5G networks operate within safe parameters. These guidelines, grounded in extensive scientific research, are continually revised to reflect the latest scientific understanding. Despite expert assurances, misinformation about 5G persists, with some unfounded claims, such as links to the COVID-19 pandemic, gaining traction. Both the WHO and the Centers for Disease Control and Prevention, or CDC, have debunked these claims, stressing the importance of relying on scientific evidence. While regulatory bodies maintain that 5G is safe within established guidelines, it is crucial to recognize the value of ongoing research and transparency. As with any new technology, public concern must be addressed with clear communication and updated scientific data. Experts argue that proactive engagement with the public and continuous research into long-term health impacts are essential to maintaining public trust and ensuring that any potential risks are understood and mitigated in a timely manner. This balanced approach allows society to reap the benefits of 5G technology while remaining vigilant about its potential impacts on health. The conspiracy theories linking 5G to the coronavirus pandemic first surfaced on a French conspiracy site, which suggested that the millimeter wave spectrum used by 5G and COVID-19 were related, pointing to Wuhan's installation of 5G towers before the outbreak. This theory quickly spread after a Belgian newspaper published an interview with a doctor who speculated on a link between 5G and the virus, even though the article was retracted. The theory gained traction on social media, fueled by long-standing fears that 5G was harmful to human health. The fears linking 5G to the coronavirus outbreak arise from a mix of confusion and long-standing concerns about new technologies. People have connected the two simply because they are both recent developments, while others interpret misunderstood legislation as evidence of a cover-up. These anxieties aren't new. Similar fears emerged with the introduction of earlier technologies like 3G and Wi-Fi. The concerns surrounding 5G have simply inherited these pre-existing worries as the technology is rolled out globally. As we reach the end of this exploration into 5G technology, it's clear that while the benefits are vast, the conversation about its potential health impacts is far from over. The promise of faster connectivity and innovation must be weighed against ongoing concerns and the need for thorough long-term research. As 5G technology continues to revolutionize our world, offering remarkable advancements in connectivity and healthcare, the debate over its potential health impacts remains unresolved. While the prevailing scientific evidence suggests that 5G poses minimal health risks when safety guidelines are followed, the need for ongoing research and vigilant monitoring cannot be overstated. The question remains: are we fully aware of the long-term implications of immersing ourselves into this new technological landscape? What precautionary measures should we consider to balance progress with public health? What do you think? Let us know in the comments. And as always, don't forget to like and subscribe to The Global Insight for more great information on the topics that really matter. Thanks for watching, and don't forget to stay tuned.